So I am incredibly honored that I get to host today's guest. We have the absolutely lovely Rachel Conrad, who, if you're not familiar with her, you should be. You can catch her recent episode on personal lived experiences with ARFID on Feeding Matters, but she does so much for our PFD community. She reminds me of one of those quiet powerhouses, right? And then you get to the opportunity to meet her. And when she speaks, it's with conviction and compassion. And it's that latter adjective that I see in dire need in our world nowadays. So, Rachel, I am incredibly grateful that you're giving us your time and your talents today. So, thank you.
Can I tell you, I'm just gobsmacked to be here, but also when I was first out in the speech therapy world, your podcast pretty much was my lifeline because I didn't have access to funds to like pay for big trainings or anything. And so I was just like dropped a caseload of feeding patients and I had no clue what I was doing. And like from 2018 on, I was like ride or die with First Bite podcast. And so, like, being on here now is like the most insane peace of mind for me. I'm like, wow, I'm here and I'm talking to you. And when I met you back in February, I was fangirling so hard. You talk about this all the time with other people. I was like holding my friend shaking and I was like, that's Michelle Dawson. Oh my God. And she's like, let's go say hi. And I was like, no. And then I came up and took a picture with you and I was like, I sent it to everybody I knew, and everybody was jealous. And I was like, this is the best day of my life.
Okay, that's great. Okay, well, folks, God, it's great to meet you. I have to do a trauma warning and date this today so that everybody knows where we are in the world in relation to today's date and recording and the episode being released. So, trauma warning up front, guard your heart. Everybody out in the community knows that we try to make this a space for advocacy, right? So one, we're going to get real and talk about ARFID and talk about lived experiences with food. And I know that's hard for some of our community members, for the caregivers that are tuning in, for the little ones that may be riding along in the back seat and know more than what they let on, goose and bear, but also about food scarcity. So as of today, and today is November 7th at 13:14, so 1:14. The current administration is trying to put a stay in the judge's mandate to fully fund SNAP. My heart is broken yet again that our administration is doing everything they can not to feed the country. And let's be honest, I work and live in Virginia, and Northern Virginia was decimated by Dodge, by the layoffs, we're still in the middle of the government shutdown. So colleagues are carrying the weight of their spouses, of their families that are out of work and have been out of work for almost 40 days now. And then we have community members who, through no fault of their own and doing everything that they can, require SNAP benefits. And to see a government working so hard not to support human lives, I feel very strongly that we need to do the opposite. So, how do you help? One, findhelp.org. You can type in a zip code and it will populate. You fill out what you need and it will populate information on food banks. Two, lots of community churches, regardless of your faith, have stepped up and stepped out. I know our own church here in Stanton, Trinity Episcopal, which is a beautiful church, um, uh, Trinity is gathering donations during service. So, I mean, yeah, you can tie it to your church, or you could just bring in food and they're going to give it out. Uh, Rachel, you had said you'd set up food tables at your center.
Yeah, so I work with a lot of like foster families and low income families. Like almost every single one of my patients is on Medicaid. And I think the thing that we tend to forget is that people with feeding differences and disorders can be really brand specific, and brands like
Yes.
any kind, really like I'm looking at my Cheez-It box right now, but like Cheez-Its, like those get expensive. And when we start to look at inflation and we look at things like that, it is really, really important for them to have access to their safe foods. And that's not always affordable. So we created a community pantry at my office. And we also made a wish list so families can write down their specific brands of what they need, or if they have a very
Yes.
specific formula, and then I'm just going out and I'm buying it. Not everybody can do that. So, like, offering up a place where people can pick up things on a donated list and do that is great. But just being a person who already has the lived experience of not being able to eat a wide variety of foods, like this, if I didn't have my income, would be devastating. I would not be fed. And that's such a scary thing to think about. And so if I'm thinking about that and I'm not directly impacted like that, I can't imagine what all of my families are going through. And so we
Yes.
set it up in like a quiet space. I have bags and boxes for them to take things. And it is a give what you can, if you can, take what you need kind of thing. And we've already had a lot of success with it. And we've just been really urging other therapy clinics in our area to do the same. And several people have, which is amazing.
Yes. And also, Feeding Matters has applications open if you have a little one that you're serving, a family that you're serving, dysphagia outreach project. So there are resources around. Um, but if you don't know, and especially for those of us that are in home health, and I mean, you're kind of working silo, right? Like you may not know. Phone a friend. Be okay to ask, hey, where do I get my family's help? And if you need help, be okay with saying, I need help, because we all need help sometime. So, anyways, folks, there's your disclaimers. There's your timestamp. I don't know what this is going to look like on release day if SNAP funds will have been restored. I know different states and commonwealths are responding to it differently, but phone a friend, findhelp.org, and let's make our community stronger. So, on that note, hi, Rachel. What made you want to be a speech therapist?
Oh man. Well, I am really blessed that both my mom and my dad are speech language pathologists. That's actually like how they met. So they're no longer together. So sorry about that. My mom's going to be like, oh my gosh, but still. Um, My mom works at our local university, Wichita State, and she teaches the autism limited language portion. But prior to that, she worked at a facility called Heartspring, which was an inpatient outpatient school where I spent a majority of my time growing up around PTs, OTs, psychologists, the works, um, and children from all ages up to, I want to say, 25 with different genetic differences and disorders. And then my dad worked on like the home health side and then transitioned to the VA here before retiring. And so my entire world was engulfed in speech therapy. And so when it was time for me to kind of decide what I wanted to do, graduating from my senior year, I was like, I really want to be a Broadway music star, but that's not going to happen. And you don't get paid very much if you're not that great. So I was like, I should do what I'm really good at, right? Like and not to sound cocky, it's not cocky at all. I just knew it so well that like it came very naturally to me.
Yes.
Like I was like the straight A kid. I didn't have to study for tests in grad school. Like it was really easy in that aspect. And then I got out in the real world and I realized how hard it was. Um, but that was kind of like my really big foundation to getting into the speech therapy world. I became a feeding therapist because, and I say this all the time just to everybody and anybody that will listen, I don't want children to grow up the way that I did. Um, and not at a fault to my parents, not at a fault to the professionals in my world, because obviously this diagnosis is relatively new. I didn't get it until I was 25 and I'm now 31. So I've only had it for a few years. But it's fascinating to like be in therapy and like be talking about my history and being like, it was present from a lot earlier than people would have ever recognized or realized. And so ultimately, I want to make sure that we're getting people the diagnoses that they need and the support and help that they need in any way that we can. And the first way you do that is by advocating and just talking about it and getting information out there. And so that's really why I'm doing what I'm doing, because the fear responses that I have around food are so debilitating that if I can help children feel less afraid and less just discombobulated when it comes to their relationship with food, like that's me accomplishing a dream and a goal. So that's really why I do what I do. I love it, and I want to make sure that every voice is valued and heard.
Yeah.
So yeah.
Okay, but take me back to the Broadway star. Do you actually sing? Because I'm also looking at all of this powerful artwork behind you, and I can't make out if that's Harry Potter holding something or if we're like what's happening back here?
This is the K-pop band BTS. I don't know if you've heard of them. Bangtan
Oh my
Sonyeodan.
god. My
Um,
younger sister-in-law is like their biggest fan.
they are tattooed on my body. I am obsessed. If I could scan the room, you would see so much more. It's my little hidey hole of my special interest up here.
Yeah.
I do have Harry Potter stuff over on this side, but it's kind of a mess over here, so I'm not going to show you.
Okay, wait,
Um,
what is your house?
oh, I used to be a Gryffindor. I'm definitely a Slytherin now.
Crazy. I'm
Yeah.
I'm definitely Gryffindor, but I wing to Ravenclaw.
Oh yeah, my partner is definitely a Ravenclaw through and through, and we match up really well because he's really grounding, and I like think with my heart very hardcore, and I'm like justice all the way. And I think that's something that people miss about Slytherin a little bit is like we are very passionate about the things that we are in love with, and very similar to Gryffindor. I think they kind of align with each other pretty well. But yeah, yeah.
Yeah.
I love to sing, which is probably like why I have this really nice microphone. I like to make my own music that I don't share with anybody. It's kind of like my own version of journaling. But I also use music therapy all the time in my sessions with my patients. I was actually Miss Rachel for Halloween, and I memorized almost every single one of her songs. And I had some kids believing I was actually her, which was such an honor because she is such an amazing human being.
Yeah.
But yeah,
You do a lot. So can you tell us about what your role is with Feeding Matters? So like not only do you treat tiny humans and their caregivers like all the time, but you do a significant amount of volunteer work for our profession, combined profession.
yeah.
Yeah.
Oh man. So Feeding Matters almost 2.5 years ago created their consortium, which is a group of lived experiences, whether they be parents, caregivers, or people who grew up with pediatric feeding disorder or ARFID. And they put out a call, and I was like, I'll do it. Like, cool. Didn't expect to get it. I got it. And then um, the consortium members put a vote together for who they wanted to be leadership, and I very graciously was shocked when they announced it, but they made me the chair of the consortium, and I was like, oh boy, you all better buckle up because I'm a hot mess. My ADHD brain is not organized, but okay, like I'm going to do the absolute most here. And so I have been leading the consortium for the last 2 years, which is just, it's a whirlwind. It's crazy. I have done things that I never imagined possible, like including this. Like I've met some of the people I have looked up to my entire career, and I have been able to advocate in such a powerful way for people's voices who have been dampened. And I also have had the opportunity to connect with other families and other lived experiences and provide like more peer networking and support rather than being like a therapist for them. Um, but we actually just submitted our research paper, so we will be waiting to find out if the art or the journal that we submitted it to approves it. So that's really exciting. My name is going to be the first author, which I'm like gobsmacked on. Research was never my thing in grad school. And one of my teachers, Dr. Self, her name is Dr. Tricia Self, she's probably going to laugh when she hears this because I don't love research. And that's like her shtick. And I loved her and I wanted to be like her, but it's just not, I'm not good at it. And I say that, but then I have a caveat to it. Research can look so different and it has so many different lenses and so many different things that you can do that I was like, I would never be a good PhD or researcher. And then I got into working with Feeding Matters, who this project is partially funded by PCORI. And the way that they bring lived experience and what they call patient partners to the table with researchers is insane and phenomenal. Like we had to take some courses to be in the consortium on research, and I was like, oh yeah, like I kind of know this stuff. And now here I am, 2 years later. I wrote a majority of the research paper, and it will hopefully be published soon. Fingers crossed on that. So it's just crazy. I also think that Feeding Matters is such a close knit community, but also like the span is so huge that you like just find this network of passionate and like empowering and compassionate human beings. And
Yes.
like it makes you feel like you can do anything. Like,
Yes.
I know I can send an email to one person and, like, get an answer for one of my patients, or if I'm just having a really hard day, like I was telling you before we started recording, like, feeling like an imposter, right? I have people I can reach out to and say, "Help, please." Like, I don't feel like I'm good enough, and I don't feel like this is good enough, and then you have that reassurance in that. But yeah, with Feeding Matters, the consortium's work, we are pushing out what we think that the field should be researching in regards to feeding differences and disorders. We are also getting ready to kind of do, I'm going to call it a launch. I don't think that's the right word, but kind of a launch where we're going to open up for people to submit research project ideas that the consortium will essentially like sit on like advisory boards for and provide lived experience thoughts as they're putting together their projects and submitting them, which is huge. Um, I think it's something that really needs to be pushed into the research world. PCORI has done a fascinating and fabulous job of this, but pushing it even further forward and really getting to the root of what lived experiences are saying needs to be identified is important. I have to be
Yeah.
careful. I can't say certain things until the paper's published.
Yeah.
So I'm like thinking about it. But yeah, so it's just insane. Like, it was like I blinked and, like, all of this just happened. Um, and the members of the consortium are just some of the most amazing people you will ever meet. Like, I have a family in them. Like, when one of us has a low, like, we are all supporting each other. And we always make sure when we meet to, like, have time to talk about hard things in life and, like, creating plans. And then it's fascinating too because our project team, which is led by Jacqueline Peterson, the CEO of Feeding Matters, and then Haley Estrom, who's a PhD RN. She is amazing. We have become such close friends, but they then will like listen to the things we're talking about and say, this would be a really amazing idea to do. And like pushing forward with certain aspects, like their podcast that they dropped,
Yeah.
that was based off of the consortium, which is just, it's cool to see all of these pieces come together and how interconnected we all are.
The amount of times I have recommended, okay, folks, if you don't have it, if you don't listen to it, please take the time, go listen to Feeding Matters podcast. It's called Feeding Does Matter. And I have recommended that to so many caregivers, like since it's come out. Especially your episode. I have I had a slew of neurospicy young ladies come to my proverbial and figurative, or yes, literal table, and trying to explain to the caregivers, I'm like, look, I can't do this justice. These are the resources. Go. How do you consume information? How are you comfortable in the digital age? And then check out these resources. But folks, also, you can put that in your evals as well as in your goals. Like, you can write a goal for a caregiver to get support for, um, whether it be counseling or whatever they need. And I have used this to kind of lift and build. Well, thank
Mhm.
you in the consortium, because this is also huzzah for doing big, scary, hard things. You can do hard things. Yes.
Yeah, we're moving on to the next one, which is presentations. We'll be presenting at Feeding Matters in February, and yeah, we're doing lots of Feeding Matters has really forced me to ground myself in the fact that I need to heal part of my inner child, but also I need to help as many of these kiddos and adults out there who are struggling as possible. And so I just hold on to that when I'm doing the really big, scary things. Like, I'm like, this is going to help somebody. Even if it's just one person, it's going to help. And so I have to do what I can to support them, because at the end of the day, if I stay quiet, nobody grows, nobody learns, right? You have to speak out, you have to say something, because when you know better, you do better.
Yeah. Honey, that is for the rest of your life. Yeah. Mm. Okay. All right. So your lived experience is with ARFID. So if I go back to um, the questions that you shared that you wanted to make sure that we covered in our time together today, you mentioned that feeding differences like ARFID and PFD are often understood. So, what is one of the misconceptions that you encounter the most often? And how do you uplift, grow, overcome?
I think a big piece that people tend to miss, in regards to just feeding differences and disorders in general, is like we hear a lot, like it's not picky eating, right? Feeding Matters says a lot of the time, like if it hurts, like it's not picky eating, right? And so when you think about that aspect, there is so much more that goes into that difference or that disorder then I don't want to eat it or it looks gross. For myself specifically, and a lot of the people I come across who have ARFID, our fear isn't necessarily rooted in like, I'm afraid I'm going to vomit or choke or gag. It is, I am genuinely afraid of this food. I'm afraid of every aspect of it. And so when we're thinking about people that are coming into our room, or we're going into their home, or we're walking into their hospital room, we need to be really cognizant that we're not dismissing things like, oh, like that's no big deal, or oh, well, we're eating these three foods. Because at the end of the day, those 3 foods are a lifeline, or the 2 foods or the 5 foods or the hot and spicy brand cheese. It's sorry, they're just sitting right here, so I just keep referring to them because 'cause they're one of my safe foods. But when you think about that aspect, we need to make sure that while we are the professional, we aren't the professional in their life. So we have to really take a step back to listen to their story and listen to where they came from, and that goes further and deeper than like just medical history, right? We need to start asking about holidays and like what's said around your child, even if they are not able to verbally communicate. What are the things that people around them are saying? Because, like you even said earlier, kids definitely know more than they let on a lot of the time.
Yep.
And that can be really harmful in a lot of ways if we have people that are saying negative things while we're around them. I'd also say too, in your evaluations or even in your sessions, like really being mindful on how you speak about their challenges. I always talk directly to the patient regardless, and I explain things on their level. And then if I need to get into more deeper, harder conversations, I will let the child play, and parent and I will step into a space where we can either see the kid or I have somebody else come in and sit with the child. And then we have our conversation. Um, and I think that is more of a respect piece, because sometimes these parents and caregivers also need a chance to like have a meltdown or have a breakdown
Yes.
and like be vulnerable and not have the strong stoic face on for their child. And sometimes they don't want to cry in front of their child, or they don't want to cry in front of their spouse. And so just being really mindful of those pieces, I think, are some of the most important factors. But at the end of the day, like, if it's scary, if it's hard, if it hurts, it's not picky eating. Um, and I get really triggered by the word picky eating. Like if somebody ever calls me a picky eater, back in the day I would just get mad and shut down. And now I'm like, no, I have an eating disorder. And a lot of the times they're like, oh, I'm so sorry. And you're like, yeah, like you don't know everybody's story. You don't know what journey I've walked. And when we stick a label like that, it's actually doing a lot more harm than good.
I just heard Goose say, "Yeah, you don't wanna be that guy," because ever since they were little, if I saw a that guy mentality, I'm like, "You don't wanna be that guy. That guy gets punched." Like, you know
Hmm.
what I mean? And Bear said the other day, I didn't realize how much that stuck, and he goes, "Mom, I've worked really hard not to be that guy, but I just don't wanna have a punchable face because this one guy has a punchable face." And I was like, "Oh my god." But, like, that guy would say something like slanderous or about picky eating and it just but like that guy. So
Yep.
yeah, that's it's fine. We're gonna navigate preteen tween years. It's going great. But I I also have to give the word of caution during those evals or during those crucial conversations. Like when the child sharing their fears, I also wonder, did this fear generate internally, or did they pick up on caregiver fears? Maternal, typically, it's sometimes there are paternal contributions for eating disorders, but like maternal body dysmorphia or
Hmm.
their own eating disorders. So when they're hearing the conversations, it might not be just said to the child, but it could be the other adults in the room having conversations about themselves. And folks, we are healing generational trauma. I do not have time for this. Yes, am I the ADHD firstborn high overachiever that burns and crashes? Yes, that is me. I own this. But at the same time, we're also the person that are going to be the sin eaters and say, this stops now.
Yep.
But those conversations, are they, and that can be hard during that first eval to say, "Hey, is this happening?" But we can make a mental note to, as my director would say, build a bridge on the first session and come back maybe on second or third
Yep.
session and say, "Hey, hey, hey," have those crucial conversations. Yeah.
Yeah, I always try to like notate too. I do a phone interview or a Zoom interview with my families before they even come into my office. One, so they can feel confident and comfortable knowing what I look like and knowing part of my story. And two, so if there's things that they don't necessarily feel comfortable talking about with their child present, they have that space to do so. And I think too, like a really big piece to understand when it comes to feeding differences and disorders, we know, especially on the eating disorder side, that there's a lot of genetic components to it. And that can be tied back. And it's fascinating, like that I've gone through this journey to like have my mom go, well, I do that. And you're like, well, where do you think I got it from? Like, I'm sorry, sorry, mom. I'm sorry, mom. But where do you think I got it from? I've got it from you. But I wouldn't change myself for the world. I really wouldn't. I was put on this earth to do something like this, and the fact that I'm doing it now, like I wouldn't change it. I not anything for the world would make me want to change who I am now. So,
Yeah. The personal lived experiences. And you know me, I'm going to infuse humor to like make the raw conversations hard, but that's how I explain to caregivers
Mm-hmm.
when I'm talking about like what they're seeing in the behaviors of the children that are looking for like self-regulation. And like some kids do look through self-regulation by chewing, and I am I want a hard crunch shatter. I love the salt bites. Hot and spicy Cheez-Its, no thank you. My GI tract would revolt. But the white cheddar and cheddar Cheez-Its, I love this because it's a shatter burst that just calms me, right? But those
Yes.
are those are some of my lived experiences, and I do not have an eating disorder. There is hardly any food that I will not try. Although Marsha Duncline did give me the crickets in a bag in February, and I was like, no, thank you. Like that was
My favorite was when she looked at me and she goes, "That's not for you." And I was like, I said, "You're right. You're right, because I wouldn't come near it with a 10-foot pole." Like, one of the consortium members, David, brought it up and he was like, "I got some to take home." And I was like, "You put that away right now. Put it away."
she
I was like,
gave me
"That's
like
disgusting."
she gave me 3 bags, and I told the boys, I was like, this wonderful human brought you grasshoppers, and I'm bringing them home for you to eat. And the boys were like, Mom, are you for real right now? And then when I showed it to them, they were like, Goose was like, I don't think that's legal, Mom. I was like, stop. But those are the lived experiences that I bring. But how do you infuse yours to support the ones that you're serving, but also to guard your own heart? Like, I just have to think that some of these sessions, when the caregivers are pushing too much, that it must be triggering.
Oh yeah. I have a therapist that I work very closely with, for myself, which
Like
is
for your
phenomenal.
for
Real,
feeding
yeah.
or for your heart.
Well, she's kind of both. Um,
Awesome.
we work in the same office, and I was like, one day I just went to her and I was like, "I really need to talk this out, but I think you need to be paid for your time because this is more therapeutic." So here we are. She is phenomenal. She's a licensed social worker and she does a lot of play-based therapy. But I rely pretty heavily on our sessions to kind of like allow myself to talk about it. But I do have a lot of, I'm getting a lot of teenage girls right now. And so I've really had to hold on to all of my tools in my toolbox for myself mentally to help them. And I say that not as like it's so hard that I can't do it, but it is more so like I see a lot of me in them. And so sometimes like you have to really rein it in and be like, this is not about me. It is about supporting them. But what I do is if they come in and they're talking about like a fear moment, or if we're working through, like, Thanksgiving is a really triggering time of year for a lot of people with feeding differences. um, and so we create safety plans. And so as we're navigating safety plans, I do a lot of like, for myself, I send an email, and this wouldn't be on you as a child, but your mom or dad could send an email to the family members with your boundaries. And those boundaries need to be respected. And that's a huge piece of it. And the first thing I really try hard to teach to any of my patients is the power of no and the respect that no deserves. If you are not ready, if you are in my session and I bring something in and you have had the worst day ever and you failed a math test, you can say no and we shift. We do something different. Um, for how I do therapy, especially surrounding ARFID, we build a profile for each individual, from the ground up. So, what foods are you eating? What foods are you interested in? What foods are your hard, absolute no's? I don't want them in this room ever. And then those are respected. It's not my job to push past a really hard no, because if somebody tried to push past my really hard no, they are cut out for me. That's a boundary. So,
What tool do you use to build this profile? Or is it one that you've just curated?
yeah, I've just made it. So each of my patients has, an Excel spreadsheet where I kind of have like a grid outline of the things I need to know and things I want to know. And that can kind of, it's broken down into like the first thing in the list is what are things that you enjoy doing in life that don't involve food, right? I want to get to know them on a personal level. The second piece is what are foods that give you the like warm happy dance? Like if you feel like
Yes.
you're going to take a bite and like what do you feel happy about? And then we go into what are foods that you eat consistently throughout your week. And then we talk a lot about like what are moments, meal times, or events that happen that bring you fear, anxiety, or just like that bubble gut where you're like, I don't want to be a part of this. And there's a lot more to it, but we do that. And then we really build on rapport. Like there has to be trust. And I think this is something that a lot of feeding therapists are really starting to grasp the concept of. But you have to trust me and I have to trust you in order for you to make any gains. And
Yeah.
if we don't have that connection, I'm going to get you to somebody that you do have that connection with. So that way you are on the right trajectory for the progress you want to make. Um, I also really focus on creating grounded goals. So if a patient is like, all of my friends are eating cheese pizza and I really just want to eat a cheese pizza, that's our that's our goal. I really don't care what anybody else's goals are at that point in time because that's what they're most motivated to work on. And obviously we break it down into really, really small steps. And we go where at the level that they're able to participate very functionally in like 100%, not like one where they might be anxious. So we start really small and we build our way up. I do talk a lot about like my personal experiences in a way, depending on the child or the teenager or the adult that I'm working with. Um, it brings that sense of relatability and similar to like how we talk with a lot of like our neurodiverse population, like when they're feeling some kind of way, I label that out loud. Like this food makes me scared. Like I have one patient who we do foods that scare us. And one day he asked me, he goes, Miss Rachel, when are we going to do mushrooms? And I looked at him and I said, I can't. I was like, I can't. Like very truthfully, I can't. I can't do
Yeah.
it. And he was like, oh, so it's like me with meat. And I said, yeah, we don't
Yeah.
push meat with you. We don't push mushrooms with me. Um, but I will bring in other foods that make me afraid and I will show them. Like I've cried in a session, and not like sobbing, but like where it's like this food is freaking me out and the thought of even trying to bring it to my mouth is terrifying. And I think it helps them feel less alone. Um, and I think it also helps their caregivers to understand like, oh, this is a real thing. Like this is a human being sitting here talking to us about these things who has lived through this and like this is their genuine reaction.
Yes.
And I think it brings perspective, and so I do have to be really vulnerable in my sessions, um, which comes with a lot of like, there are boundaries put in place. There are lines I don't cross, things that I've really worked out with my therapist to make sure that I'm still providing an ethical therapy session. But we do incorporate some aspects of like cognitive behavioral therapy where like if they start to talk about something, we will kind of address it a little bit and I'll listen to them talk about it in regards to ARFID. And then once it starts to get outside of like my food scope, we then say, okay, I love everything you're talking to me about. Are you comfortable with me sharing this with your mental health professional? And that's always a piece of trust that we really make sure we have. I do not take on an ARFID patient without a mental health professional on team. And I firmly believe that nobody should be working with an ARFID patient without a mental health professional on staff with them. Um, all of my ARFID patients, I am secondary to the mental health professional. They will sometimes joke and be like, well, you know more than I do. And it's like, yes, but you have the tools in the toolbox to teach them to be successful on the mental health side. My
Yeah.
tools in my toolbox teach them how to engage with food and have a positive relationship with food. And
It's
so there's that really big defining factor.
That's why we engage in interprofessional education and interprofessional practice. Like I go back to this all the time because we have to intimately know where our scope of practice starts and ends because I mean, you said you're 31 to my 42. So I got 11 years and a whole lot of gray and Botox on you, darling. But like when I was coming through, it wasn't clear whether or not SLPs could diagnose ARFID. So I saw colleagues and mentors diagnosing ARFID when that's illegal because it's in the DSM-5 catalog. We can say signs and symptoms of or characteristics of, please consult with da 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 da. Da. And then, folks, I hear it in your souls because I live in this space. What do we do when we can't find a counselor nearby? Like that's hard, right? So I'm going to recommend that you check out the Feeding Matters directory, because some individuals will put themselves on the directory if they're comfortable with there's a fly, it's November, what is happening now? Some individuals will put themselves on the directory and they offer telehealth services across state lines. And what I have found, uh, Holbrook, am I saying her name, Amy Holbrook? Hold on one second. Let me double check before I insert foot in mouth, because I'm good at doing that. Give me two shakes of a lamb's tail. Um, Talbot, Amy Talbot.
Oh, yeah.
Amy Talbot, she's amazing. I was like, it's not Holbrook. So who's Amy Holbrook? Because now I know this person. It will come to me later tonight. Brain. But Amy Talbot gives really good recommendations in that episode of like parallel psychologists that like they may not specialize in ARFID, but they may work in the eating disorder framework, or they may work in counseling for anxiety and depression. And there's I don't
There's
know
a
how
lot of
to.
overlap.
Yes,
I mean,
there's
yeah.
layers. Like it does, it interconnects. It's not a clean line.
No, and, like, my ARFID is directly impacted by my anxiety, like, it is, like, I will lose my appetite if I'm put into an anxious moment, like, if I have a huge spike in my anxiety, I the appetite is gone, like, I could be starving, and it is just, boom, wall down, I have no more hunger cues whatsoever, and so like one of the things we have here in Wichita is a group called The Village, and we are a provider network of people who work with perinatal and eating disorders. And so the person that started it is a social worker, and it's just phenomenal. Like we consult every Friday, we talk about our cases, we make sure that we're not operating in silos, and we talk about it all the time. And then we push out and we connect with other places and resources in the state of Kansas, and that has been a huge help. And I would say too, like if you're a psychologist or a therapist out there and like you're afraid of eating disorders, well, yes, you need to be cautious and you need to have some fear, because I think if we come in and too like we got this cocky almost, yeah,
Yeah.
we have to really make sure that we're checking ourselves. But at the end of the day, some help is better than no help, as long as you're not going against what is recommended, right? And we have access to things that help us as professionals be educated in what are do's and don'ts. But also too, like if you're needing a person and you can't find people, you can contact me and I'll help you find whoever you need. I do that a lot for the ARFID support groups on Facebook, where people are like, I live here, I need help finding a therapist. And like, I'll sit there and I do the research, and I have like a spreadsheet that I use where I keep track of people who work with patients with ARFID.
It's
So yeah,
amazing. You you are doing the work of hundreds. Like honestly. Yeah.
it can be overwhelming sometimes. Like I think people maybe don't understand, like you only see like snidbits of all of our lives, right? Like you see what we want you to see in a lot of aspects, and it can be really hard and it can be overwhelming. Like right now I'm on top of all the other things I'm doing, I'm trying really hard to start an ARFID young adult support group that's online, that will be accessible, pay what you can if you can, kind of thing, where people can come on once a week at a specific time and just have community. And if you need to eat a meal while you're on Zoom, you can eat a meal. Or if we want to do an activity like painting, we're going to do an activity like painting. And just a space where we're not surrounded by professionals, but just our own lived experiences. So I'm doing that not as a speech therapist, but as a lived experience, because I think it's important for us to have that outlet of connection. So
Yeah. Raise a voice.
yeah,
So I have wondered, and this is just me putting this out there in the universe, um, in light of the framework of SNAP and WIC and everything else. Um, I know that for an extended period of time, SNAP and WIC didn't cover a lot of gluten-free foods for celiac disease, and there's inherent barriers there. And I understand ARFID does not exist just in a silo. You can have ARFID and you can have PFD,
yep,
and you can have ARFID and underlying medical etiologies, right? Like it's
yes.
possible to have both diagnoses. But I have wondered, what would it take to get ASHA and Feeding Matters and other like allergy associations to get together to say, oh, by the way, yeah, fully fund this, but oh, by the way, we need to include these alternative um, food options for those that do have these health conditions that are underlying. I don't know if that conversation has come up in the consortium or in, yeah,
There's a lot of things that Feeding Matters is doing that, like, I can't really talk about right now, but there
yeah,
are things that are being worked on to start moving towards this aspect. Maybe not quite that direct, but there are things that are being done. I'd also say too, I think one of the pieces I get really heated or frustrated about when in regards to SNAP and EBT is when people talk about like, well, they're buying junk food.
no,
And like, I think what people don't understand is the amount of people who are on SNAP and EBT that have feeding differences. If they did like a study on it, I wouldn't be shocked if it was over 50%, to be quite honest. We have so many families that rely on that because they have kiddos or themselves are medically complex and either are unable to work or only able to work a small amount of time. And you have all of these barriers that are in place. And so when you think about that, like if you were to look at my diet, you would be like, oh, wow, from like a neurotypical lens, you'd be like, wow, she doesn't eat very well. She doesn't have like all the food groups and things like that. But like at the end of the day, for me, it's about nourishing my body and putting something into my body. Because one of the worst parts of feeding and eating differences is that when you are selective and you do kind of only have a few select foods, you actually create this nasty cycle of like cutting your hunger cues further and further down. And so if you go long periods of time without eating, your brain starts to kind of go into caveman mode, right? And you kick into this place of like, no hunger cues. I'm taking what's in the body already. And so you're kind of just like eating away at yourself. And so for me, just like we say to mothers of infants and caregivers of infants, fed is best. And so when we're thinking about those pieces, I don't care what you're buying. I don't care what you're taking from my food pantry as long as you are fed and that brings you enjoyment and you have happiness when you eat your food. That is all I care about. The nutrition aspect can come later. We need to get you consistently eating in order to then expand your nutrition and build on your nutrition. Because if we don't have consistent hunger cues, we're never going to be able to move past that small select amount of food that we have. We have to feel hunger. We have to understand that. And it can't be like, wham, bam, I have a headache version of hunger. It has to be like, let's get the tummy rumbling. Let's get that like salivation aspect going. And how do you do that? You have to do it with preferred foods and things that bring them enjoyment, which is why I always ask, like, what makes you happy dance? Because we have to get that going and we have to really stimulate that. But I would also say too, like, I would love, love, love for Asha and Feeding Matters and all of the researchers out there to dive into this. We have to feed these people. We have to help them. It is human dignity and human kindness, and we have to do that. Like, it's not a matter of if, it's a matter of when. It has to happen.
I can't not be a faith-based SLP. This is the walk that I am supposed to walk as a Christian, is to serve and feed, right? Like, this is so I don't know. I am, in all honesty, I have been struggling with this big, because it just, that righteous anger. Maybe I am a little Slytherin-y. Maybe it does exist. I don't know. And my tell is when I get fidgety, I start playing with my hair, and yeah, because I have an opinion on things. And what y'all can't see is when I get worked up on something, I take my hair up and down like a billion times. So if you catch it on YouTube, this is what's happening. But yeah. Okay. So all right, ASHA and Feeding Matters and the National Academy of Practices. And I'm trying to think who else.
All the pediatric gastroenterologists, the pediatricians,
Yes.
allergy specialists,
Yes. Registered
mental health
dietitian.
specialists.
Yes.
Yeah.
Like, let's pull this into the universe and advocate that we add in allergy friendly foods to what is supported to help these. Also, there was a bill that stalled because of a Republican senator in North Carolina that would have fully funded enteral feeds, would have been required by Medicare and Medicaid's, and it stalled. And that was a couple years ago. But for the ones that have like, um, uh, what is the condition where they can't process like certain type of fats? I can't remember the name of the condition.
So one of the metabolic syndromes. I've
Yes,
got quite a few that have they're different, like
yes.
letter number combos.
But the formulas on the enteral fees are up to $4,200 a month. And like some insurances aren't paying for it. And it's like, no, this is, if they don't have that specific formula, this is not a choice. They die. Like, it's just,
Yes,
that's what happens. So,
correct.
okay, and I know we're running low on time, but so I want to, you had such good, great questions on here, and we've like hopscotched like all over the place. But is there one in particular or like a topic that you want to make sure that we cover?
Mm.
Because we've covered a lot. Also, now I want you in the village to come on.
Oh my gosh, yeah, if you really do. There's a lot of us, but I could definitely get a couple of them. I could get you a therapist, and like a dietitian, and then we have a pelvic floor therapist. Like, it's cool. They're phenomenal.
I have wanted
Um,
a pelvic floor PT. I have it circled and asterisked on my notes, but like, yes, like let's do that.
yeah,
But
that would be amazing. But
I squirreled us. I'm sorry.
no, it's okay. Going back to what you asked, I think the thing I like to always make sure I say out loud, especially when I have a platform to do so, and I always get really emotional when I say it, but one of the things I like to remind my mom, especially, is that I know growing up, you did the absolute best that you could with the tools that you had. And I think that as parents and caregivers of people who are being raised in the feeding difference disorder world, it is really easy to blame yourself. It is really easy to feel like you're failing. It is really easy to be afraid and not ask for help because you don't know where to turn. But at the end of the day, like, you are doing the absolute best you can with the tools that you have. And so you have to keep a hold of that. You have to remind yourself of that, because I wouldn't be here if it weren't for my mom. She did so many things for me when I was little that, like, she didn't even recognize were helpful. And like, we still, like, we talk almost every day on the phone. And she lives like a 10-minute drive from me. But when we talk, like, we will uncover things that she did for me as a child that made me feel safe and secure, and she didn't realize it. And when you do these small, small pieces, like those are things I hold on to. Your children will grow up and they will get older and they will have other challenges that they face. But at the end of the day, you're getting them to that point. And so if you're feeling alone, you're feeling like things are too hard, or you're feeling like you're failing, you have to give yourself grace. You have to, because you are doing the absolute best you can, and you can't forget that. And when you know better, you do better, and that's what you have to remind yourself as you get new tools in your toolbox and things that work. They will come, they will go, things will work for a short period of time and then maybe stop working, or they'll work for a long period of time and things get better. But you have to remember that you're doing this because you love your child and you love yourself and you love your family unit, and nothing can take that away, right? You can't let outside opinions harm that family unit. And you're as strong as you possibly can be working with these or working in your own family to benefit it. And so I think that's always the piece that I really want to make sure is expressed, is that you are enough, you are good enough. And then to the lived experiences, to all the littles out there, like, we're not going to give up, we're not going to stop, we're going to do everything we can to make sure that your relationship with food is as good as it can be and where you want it to be, and that you feel safe joining any table that has food at it. And so that's kind of my biggest piece that I want to make sure everybody knows, is that you are enough, you are loved. And if you feel like you need a pick me up, call me, text me, email me. I will pick you up. I will help you, because we don't operate alone. And if we're feeling isolated, we need to get the help that we can.
Yeah. Because we're healing. Because we are. Yeah. Oh, bless. I wish you were close by. I'd hug you. Air hug.
Air hug.
Ah, I'm a deep pressure hug seeker and giver. So this is for be forewarned. Yes. Um,
Yeah.
okay. So folks, um, I personally, um, I don't like celebrating Thanksgiving. You talked about Thanksgiving as like the start of like the end of the season, right? Like it's like
It's the
holiday
bane
after
of my
holiday.
existence.
Yes. Yeah, yeah, yeah. I like to look at it as a day of gratitude. So instead of focusing on like, and it's okay, like you said, send the emails, but also put the safe foods out. Like, who
Yes.
cares?
Oh my gosh.
And
Please,
like,
please,
so
for
like,
the love of God, put the
put
safe
the
food
safe foods
out.
out. But this isn't about a meal. This is about the memory. This
Yes.
is about a day of gratitude. If we peel away all of the isms that surround this day, it's just simply a day of gratitude and spending it with those that you love. And it may not be your blood family, it could be the family that you forged, right?
Yes. I'd also say, when it comes to Thanksgiving and Christmas and all the holidays, I would really like America to move away from it being food centered. Make it more family centered, please. I don't know who would do that in the world, but our holidays don't have to be rooted in food. They can be rooted in connection and love and family. And that's where the focus should be, not on what's on a table.
I would put the focus on like everybody sit at the table and what are you grateful for? And like let's
Yeah.
start there because I can't not be the speech language pathologist. We can add language into this holiday too. And they could answer that question on a talker or with sign or with
Yes.
whatever. So like let's flip the script away from pressure on the meal and just celebrate gratitude. So there's that. Now, if somebody's listening and they are so inclined to make a donation because they got a little extra love money or mad money laying around, who can they support, darling?
I know a lot of people come on here and say this because it's such a prominent piece, but it's always Feeding Matters for me. That's my first and foremost. But my
Yeah,
second one would be, because animals are very dear and near to my heart, like your local animal shelter.
yeah.
I think a piece that people are forgetting, SNAP and EBT and like the chaos of the world, like pet food is expensive, and gaining access to that. So it's not only the people, but their pets and their that are in their family as well. And so support all the babies and the little puppies and the kitties and the gerbils and the ferrets and the snakes, whatever, any
No,
of them.
thanks. I'm out.
Sorry. Okay, I don't like them either unless they're behind a glass, but I will say, Steve Irwin, Robert Irwin, Terry Irwin, and Bindi Irwin, they are my spirit animals, and I sometimes do wish that I was born to that family because their ability to love any scaly, weird-looking creature is insane, and I'm like, a spider crawls across my desk and I am debilitated and I can't do anything and I'm out the building, everything's on fire, but
Mhm.
I do try to channel my inner Steve Irwin and be like, "Oh, aren't you beautiful?" as I'm sobbing and, like, calling somebody to come kill it and get rid of it.
No,
So
no, that's the one time I cussed in front of a kid, a spider crawled out, and I said 3 words very quickly in rapid fire, SFD was like and it was like how what are they when like the autonomic phrases that you have in like your older demented patients? I'm like, that's gonna be me. I know
yeah.
dementia runs in my family, but that's gonna be my phrase. Still, I'll be like 94 with like 2 hairs and like cuss words when I see a spider. But like, yeah. So I mean, if you are so inclined, support the scaly friends, but um just like not for me. But yes, Feeding Matters, your local pet shelter, and your food banks, babes. Support your food banks.
Yes.
But now, if somebody wants to reach out to you, how do they reach you on social media, professionally? What are your preferred sources?
Yeah, you can reach out to me on Instagram. I have my LLC. It's called Bite and Bloom Therapy, and you can find me on there. Or you're so welcome to email me. I will say I get a lot of emails, but I do respond to them. Sometimes it just takes a couple days. But if it's really urgent, I will respond as soon as possible. But my email is Rachel. So it's Rachel, and then it's PFDSLP at Gmail. And you can email me. And if you need something more urgent, you can always email me and ask me for my phone number. I will give it out to you. I'm very happy to text call if you need a support network or if you just need to bounce ideas with somebody or if you're looking for help for your child. Even if I don't practice in your state, I will find someone for you that fits what you need. Um, yeah, because we
Yeah.
all deserve to have access to care. And so we need to do the most to help people get where they need to have the care that they need. So, yeah.
Ah, ma'am, with an incredibly full heart, thank you for being you and for spending time with us today. And God bless. Just thank you.
I also need to say thank you because you have made a 8-year long dream come true by inviting me onto this podcast and being a person that I know and love and just am so grateful for your voice and everything that you do to uplift other people in this world. And you have saved a lot of grad students, a lot of us. You really have. I don't think you understand the impact that this podcast has made on so many baby therapists coming out. And it's raw and it's real. And it changed a lot of things for me perspective wise when I was a baby therapist, not knowing a single thing about feeding. So thank you. And thank you for your passion and love and care for the world because it's needed, especially in times like this.
I got nothing after that. Folks, thank you for joining. And Rachel, so much love.